All right, I'm standing here with a patient, JC, and JC wants to tell her story about what happened with her treatment here at Premier Health. So JC, when you came to us, what had been going on with your medical health?
I was unable to swallow for many months. I couldn't eat food. I couldn't drink liquids. I couldn't even swallow my own spit. I ended up in the hospital on numerous occasions getting IVs for liquids, even getting shots and stuff for being malnourished from not getting enough vitamins and minerals from food. No doctors could diagnose me. I had 21 different specialists, and between the months of December to, I think it was when I came here, April. So I had seen that many doctors in that short time frame, and I had numerous of tests with no solution in sight. In fact, I was being told that it was all in my head and that I was making it up. And obviously there was something significantly wrong. So that's what led me here.
Okay, so somebody told you to come into the office and get checked out, and we took a look at you. And during the examination, I noticed something very peculiar. Just out of curiosity, did anybody else ever even feel your neck when you swallowed?
No.
Okay, so nobody even put their hands on you?
No.
Okay, so I felt and palpated is the word we use, her neck, as she began to try to attempt to swallow, and I noticed something that even when she wasn't swallowing, that she was having contractions in her neck. The muscles were what we call fasciculating, where they're spasming continuously, and I realized that it wasn't an attempt to swallow, it was a gag reflex. So basically she was gagging constantly for several months on end, and I realized that this is something that could be helped with chiropractic, because the underlying cause that turned out to be causing this issue was that she has a scoliosis, and the scoliosis was extremely severe in its effect on her nervous system in the neck area, and it caused the musculoskeletal system, caused a radiation of a neurological problem into her central brain, her central nervous system, and back out through her central nervous system to her spinal nerves, or not her spinal nerves, excuse me, her the nerves that control the inside of her esophagus and her reflex gag. And when we did the first adjustment, it immediately relieved the symptom that nobody had been able to figure out. And how long did you think it took for you to be able to swallow after the first adjustment?
I was swallowing a lot better right after I left the office. Like I noticed a big difference. I mean, there was obviously still some swallowing problems going on, but I was now able to swallow my spit without choking on it. I was able to actually get food down, and liquid was still complicated, but I was getting some of the liquid in. And I think it was visit number 3 was when it completely cleared up, and I started to just be able to start drinking and guzzling over a period of time, and it just kind of improved greatly. Even now, I'm able to eat normally, and for the most part, drink normally.
Yeah, and because her condition is caused by the scoliosis in the way it's affecting her nervous system, it's going to get better and worse and get better and worse as time goes on. She's had scoliosis her whole life. So going through the process of correcting the scoliosis and actually straightening out the curvatures, you know, how do you feel about your future with your, you know, your health? Your health. This is not the first time you've been hospitalized. You've had terrible health your whole life. You know, there's been multiple things going on. How much do you think chiropractic is going to be able to help this now that you've seen what's going on?
I think that the chiropractic avenue is the answer for me. And the reason why I say that is because I've had so many doctors, I've had so much treatment with no results from it. This is the only treatment that has rendered me any results, and I've gotten really good results. Yeah, I do have flare-ups, but that's quite normal. But I'm still able, even with the flare-ups, I'm still able to drink and eat, so it's not going back to the way it used to. So that's not a problem. When I come here and get adjusted, it goes right back to being normal, and I'm able to drink and eat. And before I came here, I was kind of hopeless. I kind of got to a point where I was thinking, okay, I'm going to die because no doctor can help me, and I've been through so much. I figured that was the it, and I couldn't see a light. And now that I'm here and been going through the treatments and getting the stuff I need to get done, I definitely feel so much better. I have a lot positive outlook, and I'm pretty confident that.
That's what I was going to ask. You know, what would have happened if we didn't figure out what was going on.
I really think I would have died. I don't think any other doctors would have been able to help me, and they would just let me to my mind.
Yeah, so it's a very rare case to see a cranial nerve irritated and documented. A cranial nerve irritated by musculoskeletal system, but it just so happened in this case that seems to be what happened. So I appreciate you going on the internet and sharing this with people and telling people about this, because this is really amazing stuff. It's not normal treatment, but I do get to see some miraculous results sometimes when we look for what's actually causing the problem instead of just treating your symptoms.
Well, I also know that there are other patients with my problems. I've read a lot of people who have what they call dysphagia, swallowing issue, who have undiagnosed. They don't have any diagnosis as to what's causing their dysphagia. They've been through tests like me, and they just think that there is nothing that can be done about it. So I'm hoping by others who see this, who want some answers and maybe have not taken this avenue, would definitely want to try chiropractic and see if that isn't the case for them too, because chances are it might be.
Yeah, and the important thing to notice too is that you really didn't have pain.
No, I had no pain with this.
No scoliosis, typical scoliosis symptoms were absent. There was no pain, no difficulty with strength. I mean, you are a performing artist, and you had no issues with working.
I had no back problems. At least I didn't feel my own back problems. So for years I didn't even know that my scoliosis was that bad. I couldn't feel nothing. And when I came here, I was very skeptical, because I was thinking, well, how's chiropractor going to help me, because I don't have back issues. At least that's what I thought. And then, of course, the first treatment, it actually showed that I had something going on, because I had improvements in a lot of different areas, not just with my swallowing.
Cool. Well, I appreciate you taking the time to go public with this and tell everybody about it, because it's really cool, and hopefully we can help some more people.
Thank you.
Welcome.